Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us. For Your Health is a program that, basically helps you to stay informed and, of course, bottom line, stay healthy. Joining me today, as in programs past, is Katelyn Pico. She is a public health nurse here in the city of Quincy. Katelyn, welcome back.
Thank you for having me, as always.
It's always a pleasure to have you. Always a lot of great information that we share, not only with the city of Quincy and the residents of Quincy, but really throughout Massachusetts and New England and beyond.
Yes, it's very exciting that this program is expanding so much.
Might have something to do with you. Today's topic is hoarding disorder, and we will start with an outline so folks at home know what to expect, and I know what to expect. We will start with what is hoarding disorder, risks caused by hoarding, personal issues versus public health concern, organizations involved, and how to help individuals who hoard. It is a real issue, and it has psychological elements to it.
Yes, there is a mental health aspect to this, so there's a lot involved. It's not as simple as somebody just cleaning up. So definitely I got a lot of information off mass.gov and also from the American Psychiatric Association. So definitely look forward to going over some information.
Best practice, I believe, is to start with a definition. So
yes.
What is hoarding disorder?
So according to the American Psychiatric Association, people with hoarding disorder have a persistent difficulty getting rid or parting ways with possessions due to a perceived need to save these items. Attempts to throw away these items may cause extreme stress, therefore it continues to add up within the home. And this is different from clutter because at this point when somebody is hoarding, the clutter within their home is so bad that it's disrupting their living spaces. So for example, if they have a couch, it's no longer used as a couch. It's completely filled up with clutter. So it definitely interferes with the person's well-being and safety.
I think there's actually, I remember a program, I believe it's still on TV, called Hoarders.
Yes.
And often there would be paths in the house because
yes.
there were no open spaces.
Yes, and a lot of times this goes, you will see a lot of people won't let you in the house for years. A lot of times this is not even brought to our attention. They say that people start to show these behaviors around 13 years old with saving items. Individuals who hoard animals, they more see that later on in adulthood. But we do see on average some individuals, like in their 50s, they will seek help. But a lot of people try to just brush it under the rug. They're just living the life that they want to live. So we end up getting informed by either loved ones, neighbors, or police and fire will do a wellness check or respond to a call. And when they see that the home is unsanitary or hoarded, they call the local Board of Health right away.
Approximately 5% or 15 million Americans deal with hoarding.
Yeah, so it's definitely a large number of people, and there's a lot that goes into it, as I said. But it's important to know that the reason the local Board of Health steps in is because each home where an individual lives, whether they own it or rent it, it has to live up to the state sanitary code. And if it does not meet those requirements, then it's not inhabitable for humans. Therefore, if we walk into a house and they don't have the appropriate pathways to exits and it's a fire hazard, we could be lead to condemn the property.
Yeah, and often what you would find in a hoarder's home would be not just knickknacks and items and larger items, let's say, but food.
Yes. And there's a big difference between a collector who's collecting items and cleanly storing them in their home or a storage unit. A lot of times with hoarding cases, you'll find that it's unsanitary conditions, because the buildup of trash, and even in some cases you might have human feces or animal feces, so that definitely leads to a lot of health concerns.
Absolutely. Let's look at the risks caused by hoarding.
Yeah, so these risks I got right off mass.gov in regards to hoarding. So first off, we have homelessness. And as I said before, if the home is in violation of the state sanitary code and is deemed unfit for human inhabitants, the local board of health and also the fire department and building department have to act. We are regulated by state law, of course. Therefore, if an individual is living in a property that is condemned, unfortunately there is no rescue housing or emergency housing at this time, so the individual is then rendered homeless. And it's also important to know that some homeless shelters are known to ban people with hoarding disorder if their habits are interfering with other individuals in the shelter and causing harm to them. So it's a very scary thing. You want to make sure that you are not rendering yourself homeless. That is why it's very important to address this and not live in an unsanitary home.
And I know we'll get to it in the probably a later point of this program, but it's really a step process. It's removing the items, but it's removing it, and then also at the same time, I suppose, addressing the psychological aspects of the person that is hoarding.
Yeah, so there's a lot, and as we go further, we'll discuss all the different agencies that will get involved with an individual who is hoarding, because it's not just the surface level, clean it up. If you were to go into that home and throw away all of their items, it could cause a person severe stress. So there's a lot that goes into it.
Let's talk about health problems, and I'm thinking, of course, if you're in a home that has a lot of stuff, health concerns like asthma or respiratory problems because of mold is a real issue.
Yeah, so definitely like the buildup of the clutter, garbage, and then the human and animal feces can definitely cause either mold or infestation issues, which can of course affect an individual's respiratory system. There is also, with the accumulation of urine and feces, it also can increase the ammonia levels that you're being exposed to. And this can affect the individual's cardiac and respiratory systems as well. And one of the biggest problems we see with a hoarded home is like falls or accidents. For example, if it was an individual who lived alone who had a heart attack, if they're able to get to a phone to call 911, when the fire and EMTs and police get there, they might not have a clear path to get to you. Therefore, you're risking yourself because they can't get to you to bring you to the hospital.
And I guess included in that as well, if we're thinking about the structure of the home, structural integrity.
Yes. So under personal safety, we have the structural damage, because if the house is hoarded, that's a lot of extra weight on the home. So you may have structural damage. That's why the building department in the city would be involved as well for an inspection. And you also have to think of a fire hazard, which is why the fire department gets involved. Because if you think of all that extra clutter in your home, that's a lot more items to go up in flames. And it can also be blocking heating vents and also your exits to get out safely.
And we spoke about the problem with animal feces and animal too many animals living in an enclosed space. Not good for the person, not good for the animal.
Not at all. So with the animal safety, it's important to know that improper care or neglect of an animal can put the individual at risk for committing a felony level crime. So not only would you be losing your animals, but you could get fines and even have to do jail time, depending on how bad the situation is and if you are putting those animals in harm's way.
And let's talk about the risk to children.
Yeah, so children and also dependent adults that are in the home. So if it's unsanitary, of course, it's not a good condition safety-wise for a child. So if we were to enter a home and there is a child living there under 18, we report it immediately to DCF, and the Department of Children and Families would have the right to take that child out of the home until the home is then safe for them to go back. And then the same for dependent adults. The Disabled Persons Protection Commission would be the advocate and take action on behalf of that individual.
Let's take a look now at personal issues versus public health concerns.
Yeah, so a lot of times when we do go to these scenes, these homes, it is a long term, it's a gradual buildup, and then it gets very overwhelming. A lot of times people don't understand why we can't just leave them alone. But hoarding becomes a public health concern when the extent or nature of the hoarding possesses a health and safety risk for others around them. A lot of times you'll see this with overgrowth in the neighborhood that could lead to rats in the neighborhood. So we run into that risk where neighbors are concerned because their properties are then being affected. And as I said before, like the local Board of Health is following the state sanitation law. So once we see a home is not up to code, legally we have to make sure that the person is not staying in that home, because once we see it, if God forbid there was a fire, the local Board of Health would be held liable for not doing anything to protect the person. So a lot of times all the local Board of Health and the fire department, these are all regulations that we have to follow to keep that individual safe.
Needless to say, it would be a concern for a landlord as well.
Yes, and landlords can take legal action as well, because if the situation is bad, it is probably going to be breaking the lease. And then you also want to think of the damage to the property, because sometimes if this person does get evicted, the cleanup process then falls back on that landlord. So then it becomes a whole legal issue that they have to settle in the courts.
I don't know at what point I was going to bring these images to your attention, or you were going to bring them to mine, but I think this is probably a good point.
Yes.
And I know this will be up on screen momentarily, but there are stages to hoarding.
So this form is like the clutter image rating. In this situation, it's for a living room. So we use this when we go into a property to assess exactly how bad it is. Throughout, I have been in the health department for 4 years now, and I have seen my fair share of houses that people say are hoarded, but they're actually fine, versus an actual hoarded property. So that is a quick little tool that the local Board of Health uses to assess just how bad that actually is. And we also use that to communicate to if the individual was over 50 years old, we report it to South Shore Elders, and they have services and social workers that reach out to try to assist the individual. So that's a tool that we use to kind of communicate exactly how bad it is.
As I'm looking, and I'm coming up to, I believe, maybe I'll backspace. I sound like a typist, and I'm not. Let's look at the organizations involved.
Yeah, so there is quite a lengthy list of the individuals involved. And first off, we start with the local Board of Health. We always get involved. A lot of times, as I said, it's reported to us by the fire department or the police department if they're going out on either a wellness call, or if they're going out to respond to an individual who fell. They'll call us if it's an unsanitary or hoarded situation. So then it also involves housing providers, the court system, mental health professionals, social services, elder services, which locally we use South Shore Elders to report to, visiting nurses and home care organizations, legal services and housing lawyers, cleanup companies, adults, child, or animal protective services, and then again, I keep saying, but the fire department, police department, and EMTs. And I did want to quickly say, with the local Board of Health involvement, we do try our best to work with the individual. We give all the local resources. It does get hard though, because a lot of times it falls back on that individual. If their home is hoarded and they need to get a cleanup company, which can be pretty pricey depending on how bad the situation is, unfortunately, the cost of the cleanup falls back on the individual. So we do run into a lot of barriers. That's why all of these different entities work together to try to assist them. Because the last thing we want is to just walk in and find somebody or condemn a property. We try our best to work with them because we don't want to render anybody homeless.
Right, so there is help out there, and a lot of help out there,
yes,
to help someone through the process.
Yes, yes.
So we are going to be talking now about how to help individuals who hoard.
Yes, so as you can see with all those different agencies, it's multi-level. So an individual dealing with hoarding, they could benefit from behavioral health interventions, and also help with sorting and discarding excess accumulation of items. So I would like to say that the cleaning process is a very delicate process. You never want to go in and just throw everything out, because that causes a lot of stress on the individual. And that is something that could be very difficult to cope with. So there are different agencies out there that have experience with cleaning up a hoarding situation. And a lot of times when they get a social worker involved, they work with the individual to throw out what's appropriate and sort it. And I said before, but you can look online on the local state. The state would have like local resources, but also you can call your local Board of Health if you want to see what's local to your area. And another important thing is this is ongoing support, because if you go into a home, it's been a buildup over months or years even. It's not an overnight fix. So if you go in there and they do clean it all up and then you say thank you and leave, you could go back a month later and it could be worse. So you want to make sure you're doing ongoing support. And there are also support groups online. Here in Massachusetts, if you look at the masshousing.com, there are support groups available on there.
I know that where my wife grew up, there was a hoarder just around, I believe, in her neighborhood. And what you just explained happened. They cleaned, and this was actually, it was not only the house, but it spilled out into the yard.
Yes.
So anyone driving by could see it. Cleaned it up, and I'd say within a month later, a month, maybe 2 months, back again. So it's almost like unless you target the root.
Yes.
What's the
root of the
cause,
problem?
right?
Yeah,
the root of the problem. Then it really doesn't. It really doesn't help. It really doesn't go away.
Yes, yes. And I do think it's very important to know that, again, we are mandated by these regulations. So we do our best to work with people. We don't want to kick anybody out. But I understand it's their property. A lot of times they don't want us to come in, don't want our help. But we just want to make sure that they're safe at home, and we're doing our best to provide these resources to make sure nobody is unsafe.
And I suppose maybe the cause or the causes of hoarding could be something as simple as a person being lonely and collecting, let's say, a particular item, collecting tons of dolls. Actually, I can remember that from an episode.
Yeah.
And just to the degree that it made her feel good to have these dolls in the house, but it was to the point that it was just dangerous.
Yes.
And then there might be the sentimental values. So if something was given to somebody, it's in the family, it's an heirloom or something to that extent. well, that's usually 1 or 2 items. It's usually not a house full of items. But I guess what I'm trying to say is that there's an emotional connection that has to be dealt with.
Yes, and even especially with animal hoarding, because if you think of it there, it's not, that's a lot more complex, because in that situation, they have an emotional connection with their animals. Those animals are family. So especially with animal hoarding, I luckily, knock on wood, have not had to see that yet, and I hope to not in my career. But that especially would need a lot of counseling and a lot of like social worker and behavioral health help as well.
Right, because let's say that a house has cats. Unless those cats are neutered, there are more cats and then more cats and more cats.
Yes, and there's definitely, like, there's a code that you have to make sure, because with an abundance of cats, it's going to become unsanitary, because there's no way you can clean up after all those cats. So you would run into the risk of your cats being taken away if you are not properly taking care of them. So you just want to make sure that you're being careful. If you have a loved one that you know that potentially is at risk, you can call your local Board of Health. If they're over 50 years old, you can reach right out to South Shore Elders in this area to report it. But it's always good to get somebody involved to help them, because you don't want to leave them, because the situation gets worse as time goes on.
And we should note that there are many success stories, folks who have hoarded in the past that really refine their lives and their, I guess, collection. They refine their collection methods, if you will.
Yes, yeah. So definitely there is recovery. It takes a lot of work. You just want to make sure you're taking those steps. If the local Board of Health does knock on the door, definitely I suggest taking the resources that are available, because you want to make sure you're not at risk during an emergency situation such as a fire or a fall. So it's very important, and you also don't all the other health risks to your respiratory system and your cardiac system. You really want to make sure that you're not leaving either yourself or a loved one in a situation like that.
And I guess we could maybe reference this image one more time, but when we talk about hoarding, we're not talking about a table that's covered by knickknacks. I mean, this is another level.
Yes, and there's definitely different degrees of it as well. There's also different degrees of cleanup companies. Some companies are very small. They come in, they just throw out the junk that you have. Whereas other companies, if it is completely hoarded, you could need a hazmat team to come in. So it definitely all depends on that individual situation.
And the worst situation would be, and of course this does happen as well, where an individual has passed in the residence, and it may be weeks later, it may be months later that that person is found. And probably at that point might be because of the unsanitary conditions that have basically made themselves known throughout that neighborhood.
Yes. Yeah, so that definitely is a risk as well. A lot of times then at that point, if the individual who owns the house is not around, the health department, it's a whole legal issue at that point. So you want to just make sure that you're taking steps to not get into this situation. And I understand it is a mental health disorder. It is a hard thing to get over. So if anyone at home is overwhelmed, definitely reach out to a loved one, or you can reach out to the health department, and we will do our best to get any available resources.
I wonder, and you can maybe shed some light on this, was there an increase during the pandemic?
So to my knowledge, in our department, we did get a decrease in calls for hoarding cases, but a lot of that could, in my opinion, could have been that people weren't going out as much, and people were isolated. So if you think of it now, where the world is kind of a new normal, where everybody's out and about again, if you're going to check on an elderly family member that you haven't seen in 2 years, their house that could have been bad 2 years ago is now even worse because they've been delivering packages to their door. It's a slow accumulation. And I also wanted to mention a lot of times that we see with like family members we speak to for these individuals, they hadn't been in the property in years. So a lot of times an individual will meet you at the door. They don't want you to come in because deep down they know that they shouldn't be living that way. But when it's their normal everyday to-day life. So.
Yeah, it's certainly it's a medical condition, and
Yes.
that's why it's on this show.
Yes.
Well, I want to thank you for joining me and certainly getting the word out about hoarding. In the last couple of minutes, anything that we haven't touched upon?
Yeah, so I just wanted to say that these resources I got off the mass.gov website. If you look up hoarding, the masshousing.com, you can find some information about different outreach groups and support groups. And then also the psychiatry.org. There's also some information there on how to cope with helping an individual who is a hoarder.
Very good. Well, thank you. Thanks again for sharing. And again, not only with the residents of the city of Quincy, but throughout the county, throughout the state, and throughout the country.
Yes, amazing. Thank you so much for having me.
Thank you. We'll do it again soon.
Awesome.
Okay. And thank you at home for watching. You have been watching a program of Quincy Access Television. A note, please support your local community access TV station wherever you live. Thanks.